I'm a schema therapist, so I use schema therapy working with these with severe personality disorder. So the therapy uh, sort of proposes uh, that we have sort of emotional needs when we're growing up. Those emotional needs are things like safety, attunement, having an opportunity to be listened to and heard, so on and so forth. When these needs, for whatever reason, aren't met in childhood because home environments there might be abuse, physical, emotional, sexual abuse. There might be parental neglect in some way. This could be due to parents being sort of unavailable because they have their own mental health problems, because they're a single parent, because they're on drugs or something like that. If they don't get met, then what we would say is that sort of this causes sort of schemas or emotional sort of triggers, buttons, landmines, if you like, that sit within in an individual. So to give you an example, so say for instance, a client who grew up in a home environment where they experienced abandonment by mum or dad for whatever reason. So that might mean that they have this abandonment schema. And whenever they kind of move into relationships and start trying to form close bonds with other people in their adult life. So what that means is that they would then, when the schema is activated, they then start to experience anxiety around abandonment, expectations that people are going to abandon them. So if you think about it, these things become like roadmaps for making sense of life, making sense of other people. Can you trust other people? Are they going to stick around? No. Then, what's going to happen next? Well, they're going to leave you. So these things sit within an individual. What people then develop in response to some of these things in childhood are coping ways of regulating their experience of this kind of stuff. And there's sort of two broad coping ways. There's avoidance, so trying to sort of block out the feeling, not feel it. And then there's sort of overcompensation. So avoidant coping methods or ways of regulating things can be things like drugs, sex, alcohol, internet scroll, like anything that distracts us, that stimulates us in some kind of way that can become addictive and problematic. So that would be perhaps an example of a maladaptive coping method to sort of regulate sort of emotional experiences. Another way of avoiding would be just avoiding things that might trigger it. So for our client who has an abandonment schema, perhaps their way of trying to regulate their experience of abandonment. Remember, they expect people to abandon them. They're an avoidant coping person, or that's one of their coping methods. They might just never get close to people. They might just avoid relationships, or they might have relationships that are just very shallow. They never commit, that kind of stuff. So they can never get abandoned, right? Makes sense. Then there's also overcompensation. So overcompensation is when folks sort of get on top of the feeling and they sometimes do the opposite of the feeling, perhaps, right? So for instance, an overcompensation strategy or coping method for sort of abandonment might be they might become massively over controlling their partners. They might become really sort of, they might use intimidation, control, that kind of stuff to control their partners so they can never get abandoned. Now, when we work with severe personality disorder, what we know is that many of these individuals have had horrific childhoods where they have had none of their emotional needs met, and they have an enormous amount of emotional triggers, schemas inside themselves. And they have learned early on in their lives to develop sort of coping methods, ways of coping with the world and these experiences that in a sense keep them safe. So a lot of our guys have very strong overcompensating coping modes. So for instance, what would be an example of that within psychopathic clients? Well, they'd have a very strong conning manipulator. So this is a side of them that basically exploits, lies, and cheats as a way of always having control and always being able to be in charge. They might also have a side of them that uses intimidation and coercion to get what they want. So if you can't con someone, then you can threaten them. Right. They might have, typically these guys also have a paranoid over controller mode, which is a mode that's very hyper vigilant for threats and basically looking out and not trusting anyone really. So looking out for people who are dangerous and then doing what they can to be able to sort of either, nullify that danger or, so get rid of it in some kind of way. And they also have coping modes. A very common one in the forensic populations is self-aggrandizer mode, which is this kind of I'm the tough guy, I'm the king, I'm on top, like look at me, that kind of stuff. So in therapy, right? So you're getting the model, perhaps. So in therapy, what we a lot of the time are working with are these overcompensating modes. So these are emotional states that exist in an individual that become active in therapy. So for instance, with the client that we were just talking about before, he has a huge conning manipulator mode. So he comes into therapy in this conning manipulator mode, and he's telling me everything he thinks I want to hear in this conning manipulator mode. So in schema therapy, we would use things like chair work where we allow ourselves to sort of place these coping modes. We give them names like this is the part of you, the used car salesman, or this is the con man, or something like that. So we kind of agree on it, and we get some rapport, and then we'll put that mode in a chair, and then we might interview it, right? So that's not them, but it's a part of them, but it's not them. It's a side of them that kind of helps them sort of, navigate the world, deal with the world, stay safe, right? And it'll have been there for a long period of time. So in this situation, what we can do, and in the case with this fellow that we just talked about, is that I put that part of him in the chair, and it just kind of went full conning manipulator mode, and just said, yep, this is what I do, and I love it, and I enjoy it, and it's great. And why do I do this? Well, and you would ask questions, for instance, like, what do you do for, the client? We'll just give him a name. We'll call him Luke. What do you do for Luke? Well, I make sure that he's always on top. Okay. How long have you been there in his life? Well, I've been there since he was 7. Okay. What would happen if you weren't there? Right. So these are the kinds of questions you would ask, and these are the kinds of answers that you might expect to get. What would happen if you weren't part of Luke's life? Well, he would be fucked. People would exploit him. People would take advantage of him. He wouldn't know what to do. He would never get his needs met. So you usually get to the function of the mode very, very quickly, right? You start to think, okay, so this is why it exists, and this is why it gets activated and large. So in a therapy room with me or anyone like me, because these guys have massive mistrust, right? Like there's no goodwill in the world. It's like, it's a dog eat dog world. This is the mindset. Like, why the hell should they trust me? Well, they shouldn't, right? This is what the inner world is screaming at them. It's like, you just got to figure out how to navigate through it so you get what you want without actually ever being vulnerable. So once you start pinpointing these different modes for them, you then can start to kind of notice them in sessions with you. And then you can start to kind of very process challenge the experience of them being active in the person's life. So, you start to kind of question whether this needs to be there all the time, question whether it has to be 10 out of 10, or, question its value in the person's life. And you can start to have these debates with this coping mode, the conning manipulator, with like perhaps another side of them where, they want a life, they want freedom, they want to be able to make choices that they, where they don't have to worry about, ending up in jail or having problems, or, being targeted or attacked or things like that. So you can start to develop what we call cognitive dissidence for them in terms of, the value of these coping modes. Now, I should say also, and it should perhaps come as no surprise to folks listening to this, a lot of the offending behaviors often happen in the overcompensating modes, right? So it's those modes that often are meting out punishment, or exploiting situations, or hurting people. So in a sense, we understand that the offending sort of kind of sits in that space a lot of the time. And that's where we try to work with them to try to reduce them.
And you said, you said reduce them. So I wonder, with this separating out the modes, putting them in the chair, is that the goal, is to reduce that voice, or what are you trying to do? To dissolve it, to make lasting change to it?
So we would say that the modes don't disappear. They're always going to be with someone. We all have our modes. They only become bigger and smaller, right? That's really it. What we try to do is identify what the function of the mode is, and then we start to a process of being able to kind of, create, sort of recognize or identify the problematic nature of those modes. Like when you go around life lying, deceit, punishing, attacking, exploiting people, then there's going to be negative consequences. It'll be easy enough to be able to identify that. And what we try to do is then kind of, help them start to sort of maybe recognize sort of another side of themselves, what we would call the healthy adult mode, right? So a healthy adult mode is the part of them that makes decisions that actually are, that look out for them in the short term and the longer term, right? So it's the decision to, rather than sort of use manipulation and deceit all the time, it might be sort of recognizing, well, there's some times where it's relevant and maybe, but there's some times which are problematic for me. So we want to try to kind of help them be able to recognize sort of the opportunity to make more pro-social choices for themselves that work for themselves in the short term and the longer term, linked to the goals that they might have. So the goals they might have, as I said at the beginning, might just simply be, I don't want to be in jail. I don't want to be in maximum security. I don't want to be, under this order with a tag on. I don't want to have to be sort of interviewed and assessed every week, right? That's good enough, right? So let's figure out how you can get those things without letting these overcompensating modes or these modes kind of take over your life. Because when they're in charge of your life, and this is a metaphor that we sometimes use, when these guys are in charge of the life, it's like they're driving the bus. And invariably, this bus is going to go over the cliff at some point because that's what they do. That's where they go. Eventually, they're just going to drive the bus with everybody else on it over the cliff, and your life kind of, ends up where it ends up in a difficult situation. Yeah. So we try to kind of recognize the function of them. We question the validity and the usefulness of them now in their life. We start to sort of build that cognitive dissonance that maybe they're not as useful. And we start to kind of nurture and develop a side of themselves that in a sense allows them to make better choices for themselves that don't lead them back into the criminal justice system.
And it seems the goals are the glue that sort of keeps this process together. So as I understand, some psychopaths can be very cruel, but also very goal oriented. And
Yeah,
you're trying to channel that energy?
absolutely. Yeah. I mean, pragmatism is a number one issue, I think, with working with these guys successfully. It's like you have to be able to identify goals that are going to work for them and that they value, and they have to, and those goals have to come from them, right? So it's like, and I think that they can become extremely goal orientated and very disciplined at doing that if they have that clarity around, okay, well, if I do this and I stay the course, then I'll participate in this therapy and I'll do this stuff and I'll change my behavior. Um, but it has to be goals that they buy into. And also you have to, I mean, this is the tricky thing working with institutions and corrective services. You have to be able to kind of, so the initial part of engaging in therapy is being able to go, yeah, you have to be able to offer something, right? You have to be able to say, okay, if we work together, this is what conceivably can happen. And if you make promises, you have to be able to meet them. Otherwise, yeah, that's a whole kettle of fish that you don't want to open up because they'll feel betrayed by that and so on and so forth. So, but talking about the institution and corrective services is that many times I've found, and other folks I imagine who work in this space will find as well, is that you can get guys to be committed to working if they see this as an opportunity to progress and make changes and get more freedoms and more opportunity. But if the system doesn't actually sort of buy into that, or they want to constantly change the goalposts, then the whole intervention kind of goes sideways and it doesn't work. And then, they just relapse back into the chaos that probably brought them to you. Yeah.
It seems gaining trust would be so important with something like this. And in this prison environment, too, I wonder, how do you get someone to trust enough to be sort of vulnerable, to let down these modes that seem very protective? I mean, a vigilant mode makes a lot of sense in prison.
Absolutely. It's really tricky. Brad. You have to, I mean, the first part of therapy is an attempt to try to establish some kind of rapport, authentic rapport. and that just takes time. And I suppose that for me, like what it does, what I, how I approach it maybe is you have to be consistent in terms of, well, we're going to catch up at this time for this period of time, and this is how we're going to work, and this is how therapy. So a lot of psychoeducation in terms of what the process is, and a lot of talk early on about what's in it for them, in terms of like, well, we're doing this to achieve X, Y, Z. And this is what I can commit and promise to you, right? So I can commit and promise to you that if we can commit to this and do this for this period of time, then in 12 months' time, you're going to be reevaluated. And if we are able to do this, I can commit to sort of endorsing and supporting, you progressing or you being able to have done good therapy and that kind of thing. And this is where it can go. So a lot of time is spent really sort of reaffirming with them that you're part of it. You are there to assist them help themselves in this situation. But your goal, my goal, is not there to kind of necessarily make them a good person. It's not there to kind of deal with their like their insomnia or their sort of banal mental health problems, stress management or something like, although that can be important. But my goal is to sort of address the things that actually make about that person that cause the problems that get them into this situation. So it takes a long time so that's what you can do as a therapist. You can establish these things early on and work with them. But then when you're doing the therapy, like it's not like the button gets switched. It's like you're constantly also having to navigate these coping modes in the session. The conning manipulator mode, that's going to try to pull the wool over your eyes. The bully and attack mode that's going to try to sort of intimidate you or, coerce you, saying, well, if you don't give me a good report, then, bad things are going to happen. You don't know what's, so you're having to sort of navigate these modes constantly in session. And that's where I guess the schema model actually is so good at doing that because, we start to kind of not talk about, if you come in and see me and you're all paranoid and you're questioning everything I say, and then you're kind of getting really in my face and aggressive, this is not you. This is a side of you that gets in the way. This is the side of you that needs to be in control. This is the side of you that needs to have certainty. And we all know why that side of you exists, because when you were little, there was no one there to protect you, and people hurt you. They should have looked after you, and people abused you. They shouldn't have done that. So you develop these modes to make sure that you're safe now. But here we are in therapy 20 years down the track. And, it's not necessary. I'm not here to hurt you. So in a sense, you start to label the modes, you start to recognize, and you start to try to navigate yourself, navigate past them in therapy by calling them out and using the language, but you're using the language of, this is a side of you. And you're not sort of saying, well, you're a unempathic, Hannibal Lecter-like psychopath, and you can never be cured and everything like that. So that kind of language makes it a lot easier to have discussions about these complicated sort of challenges you have in therapy, if you see what I mean. Because even as we say it now, like we all have sides of ourselves that probably, aren't always very helpful. We have a side of ourselves, and if someone says, well, you're really judgmental, that doesn't feel very nice. I don't want to be judgmental. But I know maybe if someone says to you, hey, you have a side of yourself that can get pretty judgmental. All right, maybe I do. Okay. So it's much easier to have a conversation about that than it is to sort of have this sort of language of, well, this is all of you. So I guess that developing that rapport takes a long time, and it is a complicated process, and it is a process of trying to navigate these modes and turning them down a bit in session. And I find that just takes time.
We're talking about a lot of things that get at the softer side of a person, building rapport, building trust, being vulnerable. And perhaps the argument is that because these things happened in childhood, that this person fundamentally could still engage in this way. I wonder what you think of research about the brains of psychopaths, that they have perhaps just structurally different brains and that maybe things just can't reach them in the same way.
Yeah, absolutely. So, what you're talking about, like there's type 1 I think the type 1 and type 2 psychopaths. So type 1 psychopaths, where they identify the traits and qualities of these individuals, and it seems that the way they process information is just different from sort of ordinary individuals. It seems that these individuals are born rather than they're made. So these qualities sort of don't come from tragic or traumatic or overwhelmingly difficult childhoods, right? They just sort of experience less empathy. They're perhaps more prone to be exploitative and predatory in their interactions with others. And you can see that very early on, despite perhaps good parenting contexts. And then there's type 2 psychopathy, where folks have this massive trauma history and problems in their childhood, and they also have a presentation which can be sort of very BPD, borderline personality disorder, very cluster B personality disorder, but they also have a lot of the psychopathic traits as well. And you can see these individuals maybe have more of that, the pathway into the diagnosis of psychopathy seems to be sort of a traumatic one rather than just a sort of something that you're born with. Yeah. Look, it's an interesting thing. I mean, there's some debate within the schema therapy community where you sort of think you can still access the vulnerable parts in these individuals. And maybe you can. Like, I suppose that in my experience, I found with individuals who would be type 1 psychopaths, you just need to be a much more pragmatic approach. Like, there's much less access to that vulnerability, in the course of therapy. Now, I've worked with some guys who would probably fit the type 1 category. They have had, chaotic and disorganized childhoods, but they don't have the same level of trauma. And they interpersonally are very, very much that cold, very callous, and they can really, sort of will tell you about their history in terms of that. I found that with those individuals that they're just taking on a much more pragmatic approach in terms of, you're approaching, you're really kind of trying to leverage their motivation to get a better life for themselves that doesn't involve sort of the criminal justice system or whatever. And it's about being able to sort of manage, some of these coping modes, which they do have, in ways that are sort of more, that are better for them in terms of their goals. So you're less likely to access the vulnerability, more likely to sort of deal with some of these sort of overcompensating modes. Does that work? Does it make them better? Well, I've found that, these guys do tend to seem to slow down from, through, maybe that's because of therapy, maybe that's because they age out of, or they slow down because of their aging. We know that that's a factor as well. I know that what they say is they find that it's really helpful, but of course they'd say that because that's in their interest to show that therapy has been really helpful and effective. But I think that this is a way of approaching it. I know that the treatment for psychopathy, approaching it in that pragmatic, clear, concise way, these are the behaviors we've got to change. This is what we need to stop, and this is what we need to do more of. Is what indicates is helpful for these individuals.
This sounds like there's always a chess game afoot. That there are these
Absolutely.
degrees.
Absolutely.
Yeah, there's a lot of layers of things to be working on and keeping track of at all times. And so I'm wondering for you, we talked a little bit about how you pace yourself and you see other clients and things. I wonder what it's like to have a 10-year relationship with a client like this. Other people who I've read or talked with who are in this kind of space, they say that it can really wear on them. Read one woman who compared it to kind of slowly being electrocuted, to just be in the presence of so many psychopaths over time. What's it like for you to do this for someone for 10 years?